Hello, my name is Anne Costello and I'm here today as a consultant for Inspire to talk about the menopause. The menopause is a very important time in women's lives, and it's something that is relevant to women across all populations. And I think it's time to discuss it openly so that women do not feel they are alone with the symptoms of the menopause. So it's healthy to have an open conversation and to clarify what the signs and symptoms are and what people will be going through. So menopause symptoms affect 70% of women. For some women, this loss of reproductive ability may be deeply felt, but for all women, the menopause is a personal experience. So today we're going to look at what the menopause is, what are the signs and symptoms of the menopause, and what is the treatment for the menopause. So the menopause is a time in a woman's life when her periods stop. And it is caused mainly by two hormones, progesterone and estrogen. Estrogen is a hormone that controls the amount of eggs that go into the ovaries. And from the ages of 45 to 55, there is a decrease and decline in the number of eggs. And usually by the age of 55, most women have reached the menopause. And how you know you've actually reached that stage is when there is a cessation of periods for 12 consecutive months after your last menstrual cycle. So there is no blood test for this. It's the signs and symptoms that present from the ages roughly of 45 to 55. And the average woman in the UK has reached menopause by the age of 51. So the period called the perimenopause is the age of 45 to 55 years. Peripause is a time leading up to the menopause, beginning with the first clinical feature of the approaching menopause, which is irregular periods and menopausal symptoms, and ends, as I said, 12 months after the last menstrual period. There are also times when the menopause arrives early. Menopause occurring between the ages of 40 to 45 is called early menopause. Then we have induced menopause, and this is a cessation of menstruation that follows surgical removal of both ovaries when the ovaries are damaged by specific treatments such as chemotherapy, radiotherapy, or when the ovaries are removed, often at the time of a hysterectomy. So premature ovarian insufficiency, this is the occurrence of the menopause under the age of 40. And it affects 1% of women under 40 and 0.1% of women under 30. The diagnosis of premature menopause can be absolutely devastating, especially if a woman has not yet started or completed their family. And NICE guidance recommends that women who are or will be rendered menopausal at a young age should be referred to a menopause specialist for emotional and psychological support. So postmenopause is the time after the menopause has occurred, and late menopause may occur, but by the age of 54 years, 80% of women have stopped having periods. So what are the signs and symptoms of the menopause? The most severe symptom for the menopause is hot flushes in 72% of people, followed with night sweats 58% and insomnia at 64%. This is a really difficult time for people when they have difficulty sleeping and concentrating. But on top of that, with the reduction in estrogen, and less of support for joints, we have joint pain, dry skin and hair, decreased strength and density of bones, increasing the risk of osteoporosis. We're more vulnerable to heart disease and stroke, and we have urogenital atrophy, which may lead to declining sexual pleasure, also more frequency urinating, incontinence and urinary tract infections. Now this is quite a lot, and it's not that everybody will experience all of these signs and symptoms, but they may experience some of them. So let's look at the psychological effects of the menopause. Women report mood swings, having difficulty concentrating, feeling anxious, and having poor memory, and having sleep disturbance due to the night sweats, and other events that can affect and contribute to this is taking care of elderly parents at this time, or the feeling of that empty nest syndrome. Women and their partners may also have financial stressors, work pressures, maybe relationship problems, and also coming to terms with aging is quite a difficult period in women's life, and they also may have ill health. So how to take care of yourself through HRT and therapies. So this is a video from the British Menopause Society explaining HRT, its side effects and its benefits.
Hormone replacement therapy is the replacement of estrogen and progesterone that women lose after the menopause. For some women it also includes testosterone, but for the majority of women it's estrogen and progesterone. HRT can be given either as tablets, or as patches, or as gels, and most women will have the choice of which one they want to use. For some women, they will be suggested a particular type of HRT for medical reasons, but generally speaking, women can usually choose. There are different types of HRT, and it will depend a little bit on what stage of your menopause that you're at. So if you're still seeing periods, or you've had a period in the last 12 months, then you'll be given a cyclical HRT containing estrogen and progesterone, and that means you're likely to have a period every month whilst you're on it. If your natural periods are stopped, perhaps a year or so or more, then you'll go on a continuous HRT, which means that you'll have estrogen and progesterone throughout the cycle. You can take HRT as long as you need it, and the problem is that once you start HRT, you don't know how long you're going to need it. So many women go on it for maybe a couple of years to start with, to see how they're getting on, and if their symptoms are persisting, they may well choose to stay on it even longer. And there's no reason necessarily to come off HRT, providing your health is good. And every year you should have an assessment with your healthcare practitioner just to see is it still right for you, are you still on the right one, and as you stay on it longer you might want to change the type of HRT that you're on. The ladies that have had a hysterectomy are in the position where they don't need progesterone, because progesterone or progestogen is only given to protect the womb lining. So if you've had a hysterectomy, you don't have a womb, so you'll use estrogen on its own, either as a tablet, a patch, or a gel. So yes, it's a different type of HRT. It's quite common when you first start HRT to get some early side effects, so things like maybe headaches or breast tenderness, very common, and they usually settle within about 6 to 8 weeks of being on treatment. Some women will need a change in dose to get rid of the side effects, and some women will find that the first HRT that they're given isn't the best for them, so sometimes we tweak or tailor the HRT to try and eliminate side effects. Women go on HRT mainly because of symptoms, so that's things like flushes and sweats, vaginal dryness, headaches, mood changes, and those are the things that are the benefits of HRT. You see an improvement in those symptoms, and quite quickly as well. So most symptoms will see an improvement within 2 to 3 weeks, but for full benefit, I'd say you need to give it 3 to 4 months. Other benefits of HRT, well, while you're on HRT, if you're within the normal age range, so 50 to 60, you'll see cardiovascular benefits. And as long as you're on HRT, you're also protecting your bones from osteoporosis. You're protecting the urogenital system, so that's the bladder, the vagina, improving sexual function, and also cognition, understanding, memory. most women who go on to HRT between 50 to 60, or if they have early menopause, the risks are outweighed by the benefits, and that's a personal discussion between you and your prescriber. We need to talk about the risks of breast cancer, which are in association with long-term use of HRT. We've known this for a long time. We've had a lot of data now showing that women who stay on HRT over 5 years, and particularly 10 years, there is an association with an increased risk of breast cancer. However, we need to put that in perspective because it is only one risk factor, and women themselves carry other risk factors. So, for example, if you have a glass of wine a day, or if you're carrying extra weight, then it's a very similar risk to taking HRT. So yes, there is a risk, but we need to make sure that women understand the perspective of risk.
And now I'd like to look at menopause and the workplace. I'm working with Inspire. I have been working with hundreds of women discussing the menopause in the workplace. And it is great that we're bringing more awareness and more education, and hopefully more support to these women. So research done from the CIPD, the professional body for HR and people development in the UK, has come up with this report to show that women over the age of 50 are one of the fastest growing group in the workforce. 3 out of 5, 59% of working women between the ages of 45 and 55 are experiencing menopause symptoms, say that it has a negative effect on them at work. Nearly 2/3, 65%, say they were less able to concentrate, and more than 52% say they felt less patient with clients and colleagues. So we can see here that the menopause has a real effect in the workplace, and it's important that these women share their experiences, that they're listened to, and that we provide as much support as possible to them. So the report has come up with the following suggestions. So for hot flushes, having access to a fan, being close to an open window, dressing in layers, helping women with feeling uncomfortable, making sure that they are drinking enough water, that they have flexible working hours, and in some cases to be able to adapt their uniform to improve comfort levels, to take regular comfort breaks. And I suppose the big thing is the education of managers and line managers as to what's happening with women at this age, so that it is not something that no longer is spoken about, but that there are open conversations, and that women feel that they can approach the manager or line manager for help and support. So complementary and alternative therapies could also help. I have listed a few here: acupuncture, aromatherapy, herbal treatments, homeopathy, hypnotherapy, yoga, reflexology. And for stress and anxiety, mindfulness in the workplace as a fantastic treatment to help people understand what's happening, cope with what's happening, and to help them through this stage, and so also with CBT. Because hot flushes are so prevalent, just wanted to go over some contributing factors. And overweight is one of the factors, the use of alcohol, excessive caffeine intake, and spicy foods. So what life changes will help? One of the biggest areas, because of our sedentary lifestyle, is the increase in cardiovascular disease, obesity, diabetes, and decrease in bone health. So the recommendations would be to make sure that you're getting plenty of exercise, that you're eating a well-balanced diet, look at your alcohol intake, and also if you are smoking, to cut down, and if at all possible, to stop your smoking for your cardiac health. Diet for the menopause is very important. This can help with obesity, of course, and also eating the proper foods is going to make you feel better. So 5 portions of fruits and vegetables, adequate calcium and vitamin D for bone health, and also to look at protein-rich foods. Here you have your beans, your lentils, your fish, lean meat, dairy, eggs, and avoiding excessive red and processed meat. There is some evidence that long-term consumption of fish oil and omega-3 fatty acids reduces the risk of cardiovascular disease. And according to the British Menopause Society, there is a lack of evidence that vitamin supplements prevent disease in healthy adults, apart from those with specific diets or medical conditions. So now is a good time to start, this time of the year, to start looking at how you can work with your diet and work with your exercise just to improve your quality of life in general. So here are some useful contacts for you, and the first one is the British Menopause Association. I would definitely encourage you to go online and to look at some of their information. They have loads of information and loads of good contact details there for you, websites you can go on to as well. And as I wrap up, I just want to thank you for coming and watching this today. And just to remember that I hope you have learned that you are not alone in this journey, and that this is just a hump in your life, a little difficult period. And I don't want to diminish it, but I think there are so many ways of looking at the menopause, and one is to use it as an opportunity to develop self-care habits for yourself that you will take way past the menopause years. And just it's time for you to step back and think about your life's process and what is it now that you want for you. And it's a good thing to develop the habit of saying no sometimes. And when you say no to something, you say yes to yourself. So I'm going to leave you on that note. I want to thank you very much for joining me, and I wish you all the best.